Good morning, Singapore. It is Glenn, Angel, FD, and Shaun. Welcome to the big show. Exclusively live on Facebook right now, Dr. Geraldine Tan from the Therapy Room.
Good morning.
Morning, Jerry.
Morning.
How are you doing today?
We are good. I hope I am good.
Second day of the week. Last week wasn't great for you because I remember when you came on, you had a terrible Monday. Hope you're having a better week today.
It's quite exciting. So the train is still not stopping. Yeah.
Wow.
So,
Okay.
Okay.
And today you've got an interesting topic. Supporting
I know.
parents of children who have medical and developmental disorders.
Wow.
Yes. I think it was first brought up by FD because
Yeah.
you were talking about, parents with hearing impaired children.
Yeah.
And then, Glenn was saying parents who have children who have epilepsy.
Yes.
So then I thought I would broaden the whole thing, right? Because how can we just limit to one set of parents?
Right.
True, but parenting itself is already so tough. I imagine for this group of parents, it must be unbelievable.
It's very crazy. It's very crazy. And I often say and often tell many people, these parents don't get to choose their children.
True.
So it's not a choice that they make. We didn't go out and pick our make our choice from the shopping center.
Choose a family. Yeah, you don't get to pick that.
And yet these parents still continue to persevere and to stand by their children. I think it's really amazing, these parents.
Yeah, I think that many parents in these situations who are tuned into us right now,
Yeah.
if you've got any questions for Dr. Geraldine Tan, please let us know, okay? And big shout out to Ren as well, who's been wanting Dr. Jerry to touch
Yes.
on parents with kids who have epilepsy.
Yeah, and besides epilepsy and hearing impairment, what other disorders could you list just off the top of your head?
Many. So three broad categories, right? There's the medical side. So if their children have medical issues, medical meaning longer term medical issues like lupus, leukemia, all sorts of cancers, terminal illnesses. Those with developmental issues, so your hearing impaired, visually impaired, those acquired during childhood or from birth, your autistic children, those with ADHD. So actually a lot of parents struggle when the children have learning disorders and developmental disorders. So that's the developmental. Then the mental health issues. Yeah, so part of working with the young ones with mental health issues, we also work with the parents because these parents don't have it easy. Mental health issues like your depression, your anxiety, clinical issues like eating disorders, even psychosis, the whole works of it, right? I don't think it's easy for the parents.
Right. Can you imagine?
many.
Can you imagine parents who don't have the means to see someone like you, Jerry?
Yeah.
Yeah, what happens then?
Okay, so the government does try to come up with many different avenues for them. So our public hospitals, our public care do have psychologists, counselors, social workers, psychiatrists working with them. Yeah, but sometimes if it's a medical issue, you might need to request if you notice that your child is feeling a little bit down or if the parent is feeling a little bit under the weather.
Can GPs help, Jerry? Let's say for someone who's feeling unwell, who's mentally drained, they go and see a GP. Would a GP usually refer them to a psychologist or a psychiatrist?
I love how you asked about the GP, and this is where I want to give shout out to many of the GPs who are a bit more in tune with mental health issues, because these are the people that really can sayang their patients. And it's delightful to hear, like, when you go to a GP, they sit there and they really listen to you.
Yeah.
And they you that time. Very important for the parents, maybe not the parents, but I do hear a lot of elderly appreciating the GPs, where they sit and they listen, or all the young children who feel like they are important. You know how the children love to feel that they are important. So the GP would just be there and be present for them. So first touch, very important.
Jerry, we have a very long message on our Facebook page that I want to read to you. And I'd like to get your comment on it. I'm not going to mention the person's name.
Yes.
When I read the message, you'll understand why. It goes like this. Thank you so much for today's topic. It's very close to my heart. I struggle between mollycoddling my 8-year-old autistic son and being usefully negligent. On one hand, I fear that by not helping him, he will get hurt or hurt someone else. I'm what experts call a helicopter parent. I can easily spot my parenting style at the playground, hovering over the kid. On the other hand, I want to instill self-reliance and resilience by allowing him to fail at what he's doing and let him self-discover a solution. The struggle is real. One thing I must admit is to feeling irritation. It's there. It seems to be a shortage of people there seems to be no shortage of people trying to give me advice on how to raise my child. And when I notice that the teachings do not seem to have scientific data backup, I automatically switch off and pretend to understand and smile. In my mind, I can't wait for that sharing session to end.
Yes. So it touches on a few different areas that I wanted to talk about. But I guess one thing that we should understand, or what we should avoid doing, is to try and offer advice for parents, because they have so many things on their plate already, right? They have so many decisions that they need to make. And then, you suddenly, when you have an issue or you have a child, any parent, okay, you walk into any sort of gathering or event and you say, oh, my child has a fever. All you have to do is, my child has a fever. Everybody seems to have a medical degree, or is a nutritionist, or is a dietitian, offering advice. Now, whilst many of us can fend them off, imagine these parents are subjected to it day in, day out, in every situation, and random strangers come up to them and offer advice. I don't know if we are even qualified to offer advice based on a 2-second observation. Even for many of us, right, clinicians, when we have our observation, it sometimes takes a few sessions before we even dare to offer any sort of diagnosis. So who are we when we walk on the street to then offer that advice for for them, for any one of them?
Right. I call people like that, right, who
offer advice.
Always offering advice and solutions, having the taxi driver syndrome. Remember how when we used to take a cab before, you still take cabs sometimes, and if you ask the taxi driver, you start talking to the taxi driver about something.
They
politics,
know everything.
Medicine. They have the answer to everything. They do.
They do, yeah.
Not saying whatever they say is completely out of this world, but
a lot of it is unwarranted advice. Jerry, you were mentioning earlier medical, developmental, and mental areas
Health
that
issue, yeah.
that fall under this umbrella. I suppose there's no correct answer, but is there an easier area to deal with coming from the parent's point of view or the professional point of view?
Whether they have,
I mean, easier
from
to
these-
deal with and solve. You know what I mean? Like not solve, but help. If there's a one,
Okay.
yeah.
if one area that is slightly easier, I feel, personal opinion would be the medical.
Okay.
Right? You go to the doctor, you find out what's going on, and then you start the treatments, right? And there is a process. So anything that has a process is a little bit easier. So even with the developmental disorders or the mental health issues, we try to break it down into the processes. However, sometimes it is quite dynamic because there are different variables that come into play. So it's not as direct as a medical condition, or there's this issue and we offer this medication for this issue. Yeah, so sometimes it's a bit more tough to kind of manage, especially for the mental health issues.
Okay.
Yeah, or the developmental issues like ASD and ADHD, because we don't know how the child would manifest certain behaviors.
So how do you help parents actually, Geraldine? Parents who are so stressed out, right?
I know, right?
What do you say to them?
I think the first thing to think about is what they are going through, right? So they have decisions to make. We just talked about the medical conditions, so the types of treatments, or even for mental health issues and developmental issues, the type of treatments, the sheer number of choices of therapies that they need to go for. So they have to already deal with those. And sometimes, just sitting with them, going through all of that, you can see how daunting their task is. So I would sit with them and go through with them. So that's one of the areas, right? The other part that I really cannot help would be the financial part of it. So it's really difficult. Like you say, Glenn, not all of them can afford private. So, sometimes when they go through the public system, even the public system, it's quite a hefty amount because of the number of therapies, the types of medication that they have to take, so and the choice of making a decision, should I change my child's medication because there's something new in the market, so or the doctor says there's a new clinical trial out there, and would you like to join it? So I've heard parents, in that dilemma, whether should I put my child through it? And they say, Jerry, it's easier for me to go through it, but how can I make my child that guinea pig? So that becomes difficult for them. But they also then retract and say, but everything I do, I feel like I'm treating my child like a guinea pig. So much emotional turmoil that is going on within themselves. And then all the financial capital outlay. And it's not like, I invest this amount. Very traditionally, our parents would say, I set aside this amount for my children's university education. So that is an investment. But then if you think about it, where do all this money go? What do all these money mean? Ultimately, they say it doesn't matter. Money can be earned.
Right.
Very, very heartbreaking. And then the emotional side, right? They are constantly questioning themselves. Am I doing the right thing? Am I a bad parent? When autism was lesser known, one of the things that I often hear mothers asking is it my fault? Yeah. Even for children with medical issues, did I do something wrong? Did I eat something wrong when I was pregnant? Those children born with hearing impairment, visual impairment, or a medical condition or other, mothers blame themselves. Maybe if I can just tell the mothers, please do not blame yourself. There's nothing you could have done differently. Yeah. It's so difficult, this topic.
It is.
When
It's
I
so
was
heavy.
preparing it,
It is heavy.
It is
no.
Yeah.
How did it end up, heavier than the one before?
Okay, hold on. We're going to go for a traffic break.
We'll do
Hold on.
traffic.
We're back exclusively live with Dr. Geraldine Tan from the therapy room. I just want to say this to all parents who are going through a difficult time because of circumstances. You guys are superheroes.
You are, yeah.
You guys are superheroes.
I think with me, Jerry touched on something that was very personal, because I have a friend who has a child who's autistic, and the first thing that the mother went through when the child was born, and when they eventually discovered the child was autistic, was she blamed herself. And it took the entire family to support her and to bring her out of that. Because it is difficult.
It's hard,
It's very, very difficult.
Yeah, because a mother, going through pregnancy and childbirth, you protect your child.
Yeah.
Right.
And when your
Yeah.
child comes out with a complication or something that you don't foresee, automatically it's the mother.
Yeah.
And Jerry, earlier you were talking about medical issues equaling medical bills, obviously. And when you talk about money, that automatically also puts a strain on the marriage of the parents.
Yes.
How can we, I don't know, how can we tell parents that it shouldn't, or don't let it strain the marriage, because it should be a teamwork effort, right? I don't know, because I'm not in the situation, so I don't know how to put it delicately.
So one of the areas that I was worried about, when I deal with parents like that, is whether they are aligned, when they face the condition. Okay, because when they're not aligned, what happens is both parents can have different ideas what to do, and that would strain the marriage. In fact, the financial part, thank goodness, I've seen them come together, and really work through it. But for couples that are in conflict, usually is when they are torn between different sort of treatments, or sometimes like for the mental health issues or the developmental issues, one party is in denial and do not want the child to undergo any sort of therapy. Now that can strain the couple's marriage.
So you're saying there are parents that refuse to believe that their child is of a certain diagnosis? Okay. Wow.
Oh, that's
Yeah,
incredible.
especially for the developmental ones and the mental health ones, or learning disorders and the mental health issues. Yeah. Medical is quite straightforward, because they can see it. Sometimes it's a bit more concrete, more tangible. If there's a hearing impairment or if there's a visual impairment, it's quite clear. But those that are a little bit more obscure, that you can't really see visually, those are a little bit tougher for couples to see eye to eye.
Yeah,
Right.
We've got messages on our Facebook page of mothers who go, I often wondered what went wrong. I had never heard of autism until I read up on it, and when we got the diagnosis. So
Wow.
again, it's and also apparently epilepsy, getting the right combination of medicine is the biggest challenge, because apparently refractory epilepsy is very tricky. It's where seizures occur despite giving the child strong medication. And apparently anti-epilepsy medication is very, very costly.
Expensive.
Yeah.
Very, very
I won't comment on the medication itself, but I do know that, for many of the medical conditions, the medication or preventive medication can be very costly and is long term. So the parents do feel that strain and the confusion whether to continue or not when they see the child is a little bit better. So that's where the tension can arise, or the confusion can arise also.
Yeah.
Yeah.
You know what FD read early on was from Ren.
Ren, yeah.
And what makes Ren's situation even more complex and harder is that her kid has autism as well as epilepsy.
Oh, wow.
Wow.
Do the two ever or often come together? Or no?
It does. It can comorbid together. So a medical condition can comorbid. But combinations like that, are a few. It's a fraction. Yeah, it doesn't mean that every autistic child will have it.
Oh, vice versa.
Yeah.
So Ren, you're a superhero.
Yeah, it can't
Yeah,
be
she
easy.
is.
Well done.
Actually, all the parents are superheroes.
Yes.
Going through all these, and it's very tough because, like one of the ladies that came to me, I think she came for her own issue, but as we were talking, I realized one of the other issue that I often deal with, which is parents hide their children's condition. Let's celebrate our children. Let's not hide our children, right? But when I talk about hiding, I think it's because her child has a hearing impairment, and when the child needs to go through major national exams, the child might not do so well, but she comes from a space that all the children are doing very well. So then she started to hide her child. And don't do that. Please celebrate your child. Your child would definitely appreciate being, valued.
Yeah. Speaking of celebrating your child and not hiding your child, are there community groups that parents may not know of where like-minded parents who are going through similar situations can get together?
Yes, so a lot of hospitals, if you go, you ask them, they will have support groups. Private support groups are out there. One mother that I work with is Lillian Kwan. She's a mother of an autistic boy that I've seen since 4 years old, a lovely child. Now he is quite affectionate. He has worked through a lot of challenges. I mean, we're still working through. So we really, really love this little boy. So the mummy is a big advocate, and she has several support groups out there. And she has links to other support groups also. So please just feel free to Facebook message me, and I'll link you up with her. And then I lost my train of thought. It's okay.
I'm sure there's a lot of Facebook groups out there as well.
Facebook groups,
Yeah.
support groups.
I was talking about one son. I forgot about the other son. The other son is now a huge teenage boy, and he has ADHD. So Lillian has one child with autism and one child with ADHD, and she would be a wonderful person to talk to, if you're facing a lot of difficulty. Go ahead, FD.
We have a message for you from Ren, Jerry. She said, Dr. Jerry, you've already done a psychological assessment on my son in 2015.
Oh.
And she says, we'll see you soon.
Okay.
Oh, thank you for the sweet, vote of confidence there, Ren.
Now, Jerry, when parents come to you, they've got questions, obviously. And sometimes these questions relate to maybe choices that they have to make. So what kind of choices do they contemplate on?
Oh, that's a tough one. Because of one of the areas is the number of things that they have to look at, or the medical treatments that they have. So treatments and therapies, right? The therapies have so many different types of therapies, from private to public to, ST, OT, so occupational therapy, not you have your speech therapy, you have your SPED ed, special educational therapist, and the list goes on to all the different holistic sort of treatments out there. So they come in and say, look, I have all these choices. Which one do I go to first? Ultimately, it's not my choice to make. So we draw up on evidence what we have at hand to then look at it and say, which one do you feel more akin to? And perhaps we can try with this set. Sadly, it's a set that they have to try. So you have to understand that they have to have that capital to then offer it to their child, which is so difficult.
Usually, what's the main fear for a parent regarding, children with developmental issues?
That I'm not doing enough.
Yeah.
Yes.
Yeah. Always the
Every
case.
parent sing a similar tune of, is this good enough? Am I doing enough?
What more can I do? Yeah.
Yeah. What else can I do? I want to do more. I want to do more. Yeah. And sometimes doing more is really just looking after themselves,
And none of us have children or are around kids with developmental or mental issues. What should we avoid as we may not know how to behave around
As friends
children.
of the family.
Just to be, I don't want to sound insensitive. What should we avoid doing?
Well, earlier we already heard one. Can we stop offering advice?
Yeah.
Stop telling them what to do. Like they don't know already, like the whole list, right? The other one that gets my goat is, please don't tell the parent, so poor thing, your child.
Oh dear. Yeah. Okay.
Oh
Yes.
my gosh, they didn't even choose their children. So, who or what is your benchmark to say that their child is poor thing?
Yeah.
Their child is beautiful,
Yeah.
and that is. I'm sounding very passionate here because it really irritates me.
Yeah, because some people have no tact.
They've got
No
no
tact.
tact. That's what it is.
But okay, we're talking about things to avoid. Maybe after this, we can speak about things that we can do.
Yep. And the last thing that really gets my goat
Hold on,
is...
Jerry, we're going for another traffic break.
Oh,
Hold on.
okay.
Just
okay.
remember that.
We are live on The Big Show, live on Facebook right now with Dr. Geraldine Tan from the therapy room. Once again, good morning, Jerry.
So, Jerry, you were talking about things that get your goat, Jerry.
Yeah. Like that.
Yes. So one was, telling the parents what to do, saying that the children is so poor thing. And the last one is telling the parents that they are wrong.
Oh.
How dare they?
I think those comments are not for anyone.
But it slips out of our mouth so easily. And, I think it slips out because we would say, oh, don't do this. This is wrong because and we just very naturally flow into it. But we don't know the impact on the parent who has gone through so much. And I feel, with these three things that I've just said, it feels like bullying, don't you think?
Yes.
So, and I
Yeah.
feel like parents with children, trying to support these children, feel quite bullied sometimes in certain situations.
Is there a way we can compliment or be positive? Are there certain things that we can
I've
help
got a
them?
list.
Okay, great. Yay. We love
Great.
lists.
Okay, so parents all across love to talk about their children. So ask about their children, right? Ask about how lovely their children is, right? Their accomplishments. Which parent don't like to talk about their children's accomplishment, right?
Yeah.
So ask, you can be curious, just be careful with your language, right? So earlier we talked about those 3 things to avoid. So you can be curious by just asking them, oh, can you tell me more about this condition? Because in truth, we don't know 100% of anything at all. It is okay to ask. And it differs from child to child, right? Even though we have read about autism, I dare not comment on a child without first listening to the parent about their children. Every parent is the expert of their own children.
Yeah.
Period.
Sure. Yeah.
That's because every child is different as well.
Yeah.
You may have the
Exactly.
same condition, but they might be
Exactly.
behaving differently.
Absolutely.
Yeah.
Yeah. The other thing that we can do is sometimes parents are very tired already, right? And if they don't want to talk or they don't want to do something, please be respectful and just give them some space to decompress. That would be very helpful. I think the other thing that we want to impress upon is do not treat these parents like they are aliens. Please treat them like any other normal human being. That's how we can respect them also.
Yes, and understand their situation. If they're a little edgy, they're not really cheery all the time.
Yeah.
Understand their
Yeah.
situation.
For sure. Well, I like the list that you gave. Celebrate accomplishments, mind your language, educate and create awareness, respect the space, and don't alienate.
Yes.
I think those are simple
Yes.
rules.
I think those are rules we can use with everybody.
with everyone.
Yeah.
Literally
Yes.
everybody.
Yes.
And also be a good friend to
Be a good
your-
friend and a
yeah,
listener,
be
right?
there for them,
Yeah.
just be supportive for the family.
I think what we also want to do is to be their friend to offer their children hope. This is an interesting one because sometimes we forget and then we say, you mean he does this or he does that? And it sounds like a catastrophe, happening or something like that. Maybe if we can just offer hope and redirect, the energy elsewhere, that would be very useful.
Yeah.
No,
I
yeah,
think
that-
hope is so very important.
Yeah.
For these parents, because I'm just putting myself in their shoes, right?
Yeah.
And I'm obviously going to be very worried about the future.
Yes.
Will they be independent enough?
How will they look after
yeah,
themselves?
How
Yeah.
how long will I have to be by their side?
Yeah.
Well, that's a major question. I'm sure
Yeah.
they all ask.
Yeah.
Yeah.
Jerry, I do have a question on our Facebook page. It came up a lot earlier, and I just want to deal with it before we run out of time.
Yes.
The question is, and it's not really directly connected to what we're talking about. Learning disabilities.
Yes.
Is it part of autism?
The autistic child can present with learning disabilities. Yeah. So they can comorbid together. So we've got autistic children with dyslexia, dyspraxia, yes, and ADHD. So yes, definitely they can comorbid, but it doesn't mean that, again, when you have autism, you will have the rest. No, it doesn't work like that.
Yeah. Or if you have a learning disability, you don't necessarily have autism.
Yes, yes,
Right.
yes.
You'll have to be diagnosed.
Yeah. Hanisa, I hope that answers your question because it did come up a little earlier on.
Jerry, you mentioned dyslexia and dyspraxia.
Dyspraxia.
What's dyspraxia?
Dyspraxia is a motor issue. So
Okay.
they have motoric coordination issues, which makes it difficult for learning. Yeah.
Motor issues.
So that's a cognitive issue. Situation.
Motor.
Okay. All
Yeah.
right. Okay.
So it affects the fine motor, but it also affects coordination, organization.
Okay.
So they can be quite messy, disorganized.
Okay.
Yeah, learning becomes an issue. Yeah.
Yeah. Speaking of Moto, the editor of SG Karma is coming up right after this.
Yes, we've got 5 minutes more.
Same, but not the same.
Same but different. huh?
Same, but different.
Yeah.
Any more questions?
No, but
from our
statements.
Wonderful fans.
Statements again. Frida has come through and spoken.
Morning, Frida.
Very openly about how when her child was born, her child had a hyperextensible leg. and the first thing she did was blame herself.
Wait, what is that? What is hyperextendable?
Extensible.
Extensible. Like,
Not extendable.
Yeah.
Okay.
Extensible.
I think it's very bendable.
Oh,
Yeah,
okay.
yeah.
In ways that it normally doesn't.
Yeah, and so she blamed herself. Was I sitting wrong when I was pregnant? Should I have done this? Should I have done that? So the whole blame again
Yeah.
came up. So it's even for things like this. So parents, because especially mothers, I think you have this incredible connection to this child because you carried this child for 9 months. You know, there's a connection that
Of course.
nobody else has with this child.
Yeah.
So when you feel that something's gone wrong, you naturally seem to blame yourself.
Because you're nesting.
Yeah.
You know what I mean? I mean, you've got this cocoon
okay.
for 9 months, right? I mean,
Right.
you're carrying this around. And
Yeah.
so it's that little protection. And so everything that happens in there, you feel it's all happening because of you.
And you kind of like look for a reason. You can
Like, oh, did I,
makes
you know,
sense.
Did I do this?
You know,
Did I
all
do
those
that? I
old
shouldn't have done
grandmother's
this.
tales about
Right.
like using
Yeah.
the scissors and
Yeah.
going out and then this and that and eating whatever food. And then you think,
I think all these parents need a bit of self-care
yes,
and self-love.
they need to think about themselves as
Yes.
well. Yeah.
Yes. You know, because if you don't give yourself that self-care and self-love, then your children are going to feel that tension and stress and tiredness. So, you know, one more thing is probably to look for the doctors that you trust. Like, you know, I think this is very important. That's why I wanted to bring it up, because a lot of parents tend to go for people, or rather doctors that are recommended by their friends. Oh, this person is really good. Go for it. Even when people come recommended, I always remind parents to ask themselves if they feel that I'm the right fit for their child, because it doesn't mean that, you know, if one person is good or one doctor is good for a child, it's good for your child.
Right.
Only you know who fits your child. So
Yeah.
choose wisely and trust yourself.
That's
Then
nice.
we
Yeah.
can trust. You know, then your child can learn how to trust his environment also.
Yeah, I think that
Yeah.
attitude on your part is fantastic. So,
Yeah.
I mean, you're not going to be disappointed if someone sees you and goes like,
No.
okay, maybe we're not a
not.
good fit, you know?
Yeah.
It's not
No,
one size fits
no.
all, right?
Yeah.
No.
But you know,
Yeah.
Jerry, how we've been talking about parents of children with these conditions and disabilities. It's not just the parents that go through the stress; it's the siblings as well, isn't it?
Oh, yeah.
Yes.
We've
yes.
left out
yes.
the siblings through this
That is
entire
true.
conversation.
That is
And
We
true.
can always talk about siblings
Yeah.
the next time.
because they do go through
They
an
do.
awful lot.
Not a lot of attention
Yeah.
and yeah.
That's true. And maybe a quick shout out for my little workshop next week for children, because we always encourage siblings to come along with them also. So all my camps, all my workshops are inclusive camps and workshop. I've got enough people to manage all of them. So next week is a 2-hour workshop because of the March holidays. And the little ones get to bring their siblings along. So
Oh,
siblings
wonderful.
do not
Wonderful.
get, you know, thrown and cast aside or anything like that. In fact, we want them to learn how to deal with one another and to appreciate one another.
And where
Yeah.
do the parents sign up for this workshop or find out more?
You just go to my Facebook page or the IG.
So it's
and
the therapy room,
details
right?
will be there. Yes.
Okay.
What's the
Yes.
age group for the children?
So we have the primary school for next week, and most of the time it's from the primary school age, but we do have a teens one at the end of the year.
Okay.
So yeah.
So
Hi,
everyone's
Julian.
included.
It's very funny when I call him because my husband's name is Julian also. So
Is your wife's name Jerry, Julian?
No, she's not.
Thank goodness.
Okay. Well, thank you so very much for joining us once again, Jerry.
no worries. Can I just say one more?
Sure.
ending?
Of course.
Yeah.
Sorry.
Take your
sorry,
time. No,
Julian.
you can-
I just feel
Oh,
so
no, please take your
passionate.
time.
I'll kick out Julian
Yeah.
now.
Yeah.
So this is for the children that are listening in, okay? And this is what mommy and daddy wants to tell you. So to my children, if you need me, call me. I don't care if I'm sleeping, if I'm having my own problems, or if I've been angry with you. If you need me and if you need to talk, I'll always be there for you. no matter how big or small your problem is, I'll be there.
Stop making me cry.
I
Well
told you
done.
it was so difficult, right? When I wrote that and chose that, I cried, Angel. I
No.
cried.
Oh.
So it's okay.
You should have told me you got to end off with "I'll be there." Then I'll sing a
Sing.
song.
Thank goodness you didn't.
Okay.
No, I will end with that. Big hugs, Angel.
Thank you very much, Jerry. You have a wonderful day and keep doing the
I
good
will.
work that you do.
Thanks,
Leslie,
Jerry.
and have a lovely conversation with Julian.
We will.
All right.
Bye-bye.
Bye bye. See you next week.
Ciao.